Hello, this is Dr. David Green, CEO of the New Jersey Pain Network. Today's topic is the basics of sciatica. Sciatica occurs when one of the nerve roots of the sciatic nerve gets pinched. The sciatic nerve is a confluence of three nerve roots, L4, L5, and S1 on both sides. Okay, see how they come out and then come together, and then it runs down the back of the leg. 1 to 2% of the population suffers from sciatica at any one point, and the most common reasons it occurs is either due to a herniated disc, also called a slip disc, prolapse disc, whatnot, or spinal stenosis, which is when arthritis causes overgrowth of soft tissue or bone, and that pinches on nerves. The less common reasons might be a nerve root irritation from degenerative disc disease. It just kind of gets inflamed and encompasses the nerve root as well. Could be a tumor, and it could be a problem after the nerve roots come together to form the sciatic nerve. Once again, it could be a tumor or it could be a muscle disorder. How does it occur? Well, when a disc degenerates, the outer layer may tear and part of the disc can squeeze out. Okay, that pushes on a nerve. It actually doesn't cause pain just from that, but it's the inflammation that gets sparked up that leads to sciatica pain. Okay, so if this doesn't herniate and you have, let's say, a disc tear, and that's painful and inflamed, that actually can cause inflammation in this whole area. So you're not even pinching it, but it's still causing sciatica. The symptoms are going to vary with sciatica. It may include burning, electrical sensation, pins and needles, numbness, motor weakness, and rarely incontinence. That's a surgical emergency. When it comes to diagnosing the cause of sciatica, history and physical exam is far and away the most important aspect. Most patients don't walk right out of a textbook, although the symptoms often correlate somewhat with what you would expect. For instance, L5 is going to have specific areas of numbness, tingling, and pain. Nerve conduction study can be helpful. An MRI, though, is really almost a gold standard nowadays. So here's a disc herniation, a large one actually, with the disc here, disc herniation, and then the nerves are trying to get out here, but it's getting compressed. Okay, so a lot of times the MRI will match up with the history and the physical, and this is a straight leg raise test. The pain doctor will lift up the leg straight, and that puts tension on the sciatic nerve and causes an increased pain. When the pain doctor bends the knee, the tension goes off the nerve and the pain goes away. Okay, if the MRI and everything is just inconclusive, a nerve conduction study can help, but also a diagnostic injection. Let's say you suspect L5, you do an injection around L5 with numbing medicine, the pain goes away. You can say, aha, that is in fact the problem. Treatment with sciatica, there's quite a few treatments. It used to be thought that like a week in bed was good. That's now, we know, a bad idea. As little time in bed as possible is best. Medications may include something over the counter like NSAIDs, or prescription ones such as opiates, muscle relaxers. Neuropathic medications such as Lyrica can be very helpful. Physical therapy and chiropractic treatment can also be helpful. TENS units, such as you see here, which is about the size of an iPod, runs on a battery. Foam pads go on the skin and transmit electrical impulses through the skin. It can change the way the brain perceives pain signals. Acupuncture, spinal decompression therapy, and then interventional treatments such as trigger point injections, and then epidural injections, which have been done for over 50 years, such as you see here. Here's a disc herniation pinching on a nerve root. This is a epidural, putting steroid right around the area that's being pinched, soothing that with anti-inflammatory cortisone steroid. Well, what are the outcomes? Over 95% of sciatica patients are successfully treated without surgery. Okay, there's a landmark study in the Journal of American Medical Association in 2006 showing that the one-year outcome between operative and non-operative patients completely identical. So if you can control the pain with non-operative measures, the outcomes are going to be the same. Now, here's some indications for sciatica surgery. If you have that incontinence, which is cauda equina syndrome, surgical emergency. Need to have surgery within 24 hours. If you start to have muscle weakness, like a foot drop, that's a relative indication. You can watch that for a while to see if it starts to get better. You don't want to watch it too long. If it's anything over, it's variable, maybe 6 weeks, maybe 12 weeks. If you watch it too long and then you end up having a surgery, even if it's technically perfect, it still may not get better. So there's a fine line between how long do you wait. And then if you fail 6 to 12 weeks of non-operative treatment, the indication for surgery is there as an elective indication. The top non-operative pain management in New Jersey is through the New Jersey Pain Network. There are several clinics throughout the state, accepting over 50 insurances with the board-certified award-winning doctors. Visit us online today at newjerseypainnetwork.com, and then call us for more information and scheduling at 844-2NJ-PAIN. I'm Dr. David Green with the New Jersey Pain Network. Your pain stops here.